Good afternoon, everyone. We'll move on to our next IC. So, the IC is on practical tips and pearls for eye hospital planning for NABH. So, our normal NABH training course goes in for 3 to 4 days. We have tried to shorten and bring around the capsule of all important points for you, which will be covered in next 1 hour or so. It is already a good discussion point for people who are in process, but I believe it will really benefit people who are planning to go, because you will have a limited information beforehand so that you can plan effectively. So I'll invite the instructors for the course. We have Dr. Nirmal Frederick with us. Dr. Nirmal Frederick is incoming president for TNOA. He has his practice in Tamram, Chennai. He's a member of IMA and also the chief architect of NABH eye care standards. We have all learned from him, and I feel he's one of the best person across India to talk and learn anything about NABH. We have Dr. Kumran. He's owner of Kumran Eye Hospital, and he has a very keen interest in OT and sterilization technique. Kumran, sir, not coming. Anyone? No one wants to come up. We'll present from there. Okay. So, okay. And so we start, sir? Okay. Dr. Sean De Silva, he's medical director of ASG Eye Hospital, Goa. And if you really like him, he'll invite you to Goa to enjoy. He'll be talking about some pain points and certain common questions which you will have, and he'll also lead the panel discussion for you. Dr. Shakeen Singh from Amritsar will be talking about the assessment process. If you're having an assessment, how you should behave, what you should arrange during assessment so that you really don't have problems. So he'll be sharing his experience with that. Incidentally, Dr. Shakeen, Dr. Nirmal, me and Sean, all of us are NABH assessor. So we have really gone across and assessed lots of organization, and we'll definitely be happy to share our personal experience with you. So I'll take up the first, I'm Dr. Gagan. I work at Narayan Netralaya, Bangalore. I had the orbit oculoplasty oncology services. And NABH is something where we all like to do honorary work because we believe in quality. We like and we feel that it has benefited us, and we like to get other patients and other hospital also to benefit from it. So these are my financial disclosures. So the first thing, IPL is going on. So IPL rules are different from ICC rules for, let's say, T20 and 50-day match and test match. But we all play gully cricket, and gully cricket has its own rules, right? One tip, one out. You can't hit the ball. If you hit a ball onto a particular side or boundary, you're out. So the whole thing is, to play a game, there has to be a set of rules, and it's a mutual set of rules agreed upon by everyone, right? So this simile is what we are going to talk next. And these are some of the abbreviations which all of us are going to use, and you will find it being used in other courses and WhatsApp and whatever, which says, what is SCO? SCO is an healthcare organization, means a big hospital, more than 50 beds. So all big hospitals are SCOs. SHCO is a small healthcare organization, which means it's less than 50 beds. And ECO is an eye care organization. So whenever you go to all our state level meetings and all discussion on WhatsApp, this is what you're getting. So these three terms, please remember. And these are the rule books, right? So if you are going in for NABH accreditation, you have different set of rules. So you have eye care book, you have small healthcare organization standard. You have a pointer, please. So this big one on the left, you see, this is the big book for big hospital. This is a SCO book, and this is a mother book. This is the entry level book, the basic standard which we all try to get. And this is the eye care standard book. So eye care standards are more suited for our kind of practice, because if it's a standalone eye hospital, we have certain different ways of working from other hospitals. This is what you will get in all standard books. So if you will open any of these 5 books which are applicable to us, you will get 10 chapters. So all books have 10 chapters. So these are the These are the 10 chapters. So all book will have first 5 chapters like this. This is 5. These are all what we call patient-centered standards, or this is where the clinical things would be there. These are more management-centered, organization-centered standards. And these standards are all abbreviated. So this is the next thing which you have to remember. So when someone says AAC, they are referring to the first chapter of every book. Every book first chapter is AAC. Okay. Now, why did we come across to this difference? So this will give you an idea now. A healthcare organization standard, what we saw, has got 651 objective elements. Means that we check in for 651 points during assessment. Whereas if you go in for an entry level, it would be 149. And an eye care has a check like 305 applicable elements which you are going to check. So they are all going to be different. And an important thing is, I can give you a real example which is often repeated whenever I talk. Two of my students have a hospital which is about 2 kilometers apart on the same road in same locality. And both of them underwent their NABH assessment at a gap of few days. And they met on a Sunday, probably having food and drinks together. And then they ended up saying that, my assessor was good, my was bad, he told me this, you have not this and something. So went on for a while, then they picked up phone and called me. And I also got, I said, this is not possible. Then I said, okay, where you have applied for? So one of the gentlemen has applied for entry level, which is only 149 elements. The other person has applied for eye care, which is 305. Right? This is accreditation, this is certification. So obviously, this gentleman will not have many things required for him because we are not going to check on that. Right? So when assessors are coming, or assessments are happening, or programs are being conducted, please understand what is applicable to you. If you are taking this rule book, then we follow this. You can skip all the things which are mentioned here which are not applicable to you. So where are you going to start? And where are you going to get these standard books? These are all freely available on NABH website. So nabh.co, you go to NABH website, all the standards are available for free download. So you can download all these books if you want. If you want a printed copy, you have to pay and then it comes by post. Next thing would be some resources where you could refer to when if you want starting. So you go to the website here, and once you're going to website, you click on this accreditation button here, accreditation radio button. You're going to go down, you're going to find eye care organization here. And if you're going to go onto this page, something like this will open, which will give you all the basic information regarding eye care standards. So where to start, don't ask your colleagues and friends, go there, read, it will take 15-20 minutes. The basic resources are all mentioned here. All your initial doubts and queries are here on this page. In case you are not going for eye care and you are going for entry level, that will come under certification tab. You go here, come down, you'll find this entry level certification program page. And here you'll get all the information which is related to this. Okay, so if you'll go there, you'll find all documents. All this information is what basically you can orient yourself and start before you start talking to other people, start talking to consultants in particular, because they will hide many of this pertinent information from you in the beginning and reveal it only in the end. If you go into that link here in accreditation to HCO, the blue book which I was talking to you, there it has also got details of surveillance and how the assessment process will take place. So this is how assessment will happen. You can go there and really get a first-hand information that what exactly is going to happen and how it works. In addition to that, a biggest thing would be your OT, because OT is one key area for us in ophthalmology. So you have to go there in the resources tab here, and you'll get this too. You'll get the guidelines for OT, and you'll get some information on the fire NOC requirements, which are these two are the key things which everyone will have question. And you have this information, this is what will be current, and this is what will be applicable to any kind of assessment. Next thing is, if you are going to the further step, please refer to AIOC CME series. Dr. Nirmal is the editor for this, and most of the common discussion points are there in chapters, and it has all the information which can really help you in ophthalmology. So this CME series is focusing more on ophthalmology, not on other specialties. So that's why it will be a key resource for you. All of us have contributed to the book. You can download it freely from AIO's website. So these are the chapters here, and you will find these chapters useful if you are planning or if you are even having NABH. You can see this and improve upon your system and processes. Most one of them in NABH would be importance on hand hygiene. And the best way to get hand hygiene thing is you go to the WHO website, type WHO guidelines on hand hygiene, you'll get this page, which will have all the information how to implement this in your hospital, including videos. And we have something called a safe surgery checklist, because NABH places patient safety at a very at a beginning. So for WHO safe surgery checklist is what we NABH recommends. You will get this kind of a page, and we have all publication in Tamil Nadu Journal and other journals where this checklist is slightly modified for ophthalmology, like IOL will come, A-scan and all things will get added. And this checklist is what we use for each and every patient. You can modify this checklist and then use it in all files. This is a mandatory requirement. And you will also have videos here which your staff can go through to see how do we do a timeout and implement this checklist. We also need to have a list for high-risk medication. A common question would be, what are high-risk medication? You go to ISMP list. You get an entire list of high-risk medication. Out of this list, whatever medications are in use in your hospital, you will select those. Because when I say here, the next time you download the entire list and put in the hospital that this is a list of high risk. No, out of this list, whatever we are having in hospital, that list we have to display, and that is what we use in different areas to have an alert for high risk medication. Then there is also a very important thing you will have heard, LASA, look alike, sound alike medication. So a simple example will be if you use dilating drops, whatever, let's say Tropicacil and Tropicacil Plus. Both of them, if you see, they look alike. Only the cap color is different. The bottle is the same, name is same, very easy to mix. So that's where, if you are having look-alike and sound-alike drugs, you have to identify them and not to store together. And I am very sure if you are using these two medications in your OPD, all of us would agree that many a times our staff would have mixed. You tell them to put T-plane, they will go and put Tropicacil Plus. You tell them to put Tropicacil Plus, they will go and put Tropicacil plane. So that kind of mistake happens. And to prevent those mistakes, we need to have this policy of look-alike, sound-alike drug. This also list is available. You can Google, or at least in our eye drops, it's quite similar. Each company, all their medications look clone of each other. Other thing is, if you are delving further, CAHO website is there. CAHO is a consortium of accredited hospital. In this, if you'll go, there's a resource column again. They have good stuff here to understand and read. In addition to that, you can also refer to AIOS website. All of us have, had this AIOS talks in meetings and all, which are uploaded. There also you'll find very good talks already uploaded for you to see. And it's not only that India has NABH. Worldwide, other countries also have their systems and they have their website. And if you go there, you will also find certain things which you can incorporate in your practice with or without NABH. They have certain good, interesting things which you can take down and use. And especially the UK website has got lots of other things also. So these are good websites to access and overall improve our practice. So other thing would be the process of any accreditation for eye care standard or even online. The process is totally online now. So you will have to go to the website which I showed, log in, create your account, pay the fees and go through the process. I just skipped that, but your NABH process is online and you have to keep your login ID and password credentials with you because that is what is going to be used for communication, everything. So whenever you are implementing, make sure that you are having the login ID and password of your application, because all of us have incidents where the staff who was handling suddenly leaves and is not willing to share. Then you have to go to NABH and give it back to me or whatever. So whosoever is handling your NABH account, please make sure that you have the login ID and password for your account. So these certain things were why we had eye care standards. So just briefing you on that. So eye care standard is a brainchild of AIOS. AIOS spoke to NABH and they wanted the standards which are specific to eye because we don't have daycare standards, whereas our 90% of work is daycare. So as a start, to get that ophthalmology focus, we have only specialty centered eye standard, which is eye care. Other specialties have also approached, but NABH has said no. So we are lucky in that way that we have a standard, specific eye care standard, which really comply to our kind of working much more. And this was a team led by Dr. Nirmal. So 5 members from NABH and 5 members from AIOS. So this 10-member group drafted these standards. That's just to give you a historical perspective. There's a team, and Dr. Nirmal would be somewhere there. Okay, so some of the reasons why eye care standards were there, Dr. Sean will cover in the last talk, so please be here, you can connect the dot there. He'll just speak about certain areas where eye care standards are more suited to us. And this is the last slide. What do we gain out of accreditation? Anyone would like to answer from audience? Yes. So money is the biggest motivator. Insurance empanelment and extra payment from CGHS and all is the thing. The only problem in that is when hospital go in for accreditation just because of these purposes, they don't sustain. So many hospitals will just push initially, get their accreditation, and after 2 years when the time comes for renewals and surveillance accreditation, the process has not been set in place and we found it lacking. So in case that's the primary motive also for us that we are going in for empanelments, insurance, extra money, but still we'll have to maintain the process to have that going on. Otherwise, after the first assessment, things start going south. Right. So other accreditation benefits which probably you may or may not agree, or sometimes actually I used to fight a lot when they started NABH in our hospital with people, what the hell, and you're making us do extra work and everything. But later on, I do realize that some benefits are there which we may not realize in the beginning, but they start occurring to us 2-3 years down the line. So one of the important things is their definite overall quality improvement. And to get an idea, leave ophthalmology, go to any NABH accredited hospital for any other specialty and just see a non-accredited hospital, you yourself will find difference how the system functions. It's a well-oiled machine because all the parameters are put in place. Definitely enhances patient safety because we have all the things in place. I told we will have emergency facility, you will have your code blues, you will have patient care parameters being checked, and also you will have more patient safety. It is also a good branding and marketing exercise. All the hospitals probably display the logo. We are NABH accredited, first in Kochi, first in Kerala, or whatever way it is. And helps in risk management. We have not discussed here, but there is a chapter where we are going to talk about identifying risk and how do we manage risk and reduce risk. It also places a very big important stress on your medical record. And that is something which I realized later, because when we have medical record, it's not me alone. The duty doctor would have put notes, a nurse would have put notes, other consultant would have put notes. So if a patient is there, the file ultimately has many people involved in it. And then you get a court case after 5-6 years, come and give an expert evidence, it's an MLC case or something. So you will realize that whatever I have put is fine, but otherwise the file is all haywire. And we can't work 24 hours. So that thing is what the medical legal risk, the last slide, that completion of file, now I know because of NABH, everyone is going to maintain the file properly. Other people would have also put notes properly. So if I get a court notice and if I have to submit file, it is much better shape. It's a complete file. You tell me you need to get the file tomorrow, we'll give you tomorrow. So there is no need even for us to review the file. So that improvement in medical record is good, and all the consent will be placed and all, which I realized later when, after 2-3 years, I realized, yeah, I was maintaining medical record because all of us feel we are doing the job, but others are not. But definitely there are many misses. And some cost efficiency. So our stores and all, OT, there are lots of wastages happening, which we probably sometimes don't pick up. At least with NABH in our pharmacy, stores and OT, the consumable part, we did find that there is a lots of efficiency which has come in and lots of wastage is getting saved. Thank you for your kind attention.